Welcome to Protecting Yourself from Disease, a standard precautions review for caregivers, brought to you by American Way University. My name is Angie Danielski, and I have developed this course to help you review this important topic. Here is an overview of what the first part of this presentation will cover. We'll begin by discussing communicable diseases and how to prevent the spread of disease. Next, we'll discuss bloodborne pathogens. In part 2 of the presentation, we will first discuss hand hygiene, including the use of hand gel and hand washing. We will then move on to discuss personal protective equipment and infectious materials. In the final portion of the presentation, we will discuss other areas pertaining to standard precautions, including food service, housekeeping, and laundry. We will then finish up by discussing post-incident exposure and exposure control plans. Communicable diseases are any disease that can be passed from one person to another. The most common types of communicable disease that we think of include the flu and the common cold. There are, however, many other communicable diseases, including some that are also widely known, such as tuberculosis, also known as TB, chickenpox, C. diff, MRSA, VRSA, or VRE. There are some other less common communicable diseases which we tend to get vaccines for, making them less likely to be seen, including measles, mumps, and rubella, pertussis, or whooping cough. A subset of communicable diseases also includes bloodborne pathogens, such as HIV/AIDS, hepatitis B, and hepatitis C. We'll talk more about bloodborne pathogens in upcoming slides. In order to prevent the spread of disease, there are some very simple things that caregivers can do. Perhaps the easiest is performing hand hygiene. This can either be washing your hands or using an alcohol-based hand gel. Wearing gloves is another important measure that we can take to prevent the spread of disease, especially when assisting residents with some activities of daily living. Caregivers are encouraged to wear other types of PPE when needed, such as masks, gowns, and goggles. We'll discuss more about PPE later in this presentation. Lastly, placing needles or other sharp objects, such as broken glass, in the sharps container also helps to prevent the spread of disease. A bloodborne pathogen is a disease-causing organism that is found in the blood. The pathogen is transferred from one person to another by blood-to-blood contact. This may either be by direct or indirect contact. Direct contact occurs when the person comes into contact with someone else's blood. This can occur by not wearing gloves when performing a blood sugar test on a diabetic resident, or when caring for an open wound without gloves. Indirect contact is when there was blood on an object or surface that comes into contact with the person's skin. The surface was not disinfected before the person came into contact with it. Exposures to bloodborne pathogens often occur by accidental exposure in the assisted living setting. If giving a resident an injection with a needle, make sure that you never use two hands to recap the needle. The swoop and scoop method should be used if a needle must be recapped. Also, always wear gloves whenever you may come in contact with bodily fluid of a resident. A good philosophy to follow is if it is wet and not yours, don't touch it without gloves. Bloodborne pathogens include HIV/AIDS, hepatitis B, and hepatitis C. HIV/AIDS is a bloodborne pathogen that affects the immune system and lowers the body's ability to fight off infection. HIV/AIDS has no cure, but there are medications that can help control the virus. Most often, people are put on several medications to help keep levels of the virus in the blood low enough so that the person can live a normal life. People usually don't die from the virus, They die because they get an infection because their immune system is not healthy enough to fight it off. Hepatitis B is a blood-borne pathogen affecting the liver. The virus will cause damage to liver cells to the point where a person may die or require a liver transplant. Hepatitis B does not have a cure, but it also has medications to help reduce the viral load. Medications are oral that help control the virus to minimize liver damage. There is a hepatitis B vaccine that employers must offer employees within their first 10 days of employment. The hepatitis C virus is similar to hepatitis B in that it targets the liver and causes damage. However, there is no cure for hepatitis C, nor is there a vaccine. Hepatitis C treatment usually lasts 48 weeks and is a combination of oral medication and a weekly injection. Treatment success for hepatitis C is currently less than 60%. You have reached the end of Part 1 of the American Way University training of Protecting Yourself from Disease, a Standard Precautions Review course.